MRI uses a really strong magnetic field and radio waves to take high-quality diagnostic images all throughout the body without using harmful radiation. So it is a really safe test for patients to have, and it's a safe environment for techs to be in, but one of the important roles of an MRI technologist is to screen and prepare patients to ensure that they're safe to enter the MRI environment. MRI is usually one of the last diagnostic events that happen before a patient receives a diagnosis, and so patients have had a lot of experience in other areas before they come to us, and we kind of finish their care before a treatment plan begins. The MRI program is condensed, so students learn everything they need to know about MRI in 2 semesters of learning at NAIT on campus, and they take those skills that they've learned and practiced into a full year of work-integrated learning and working directly with patients to practice those skills in the clinical environment.
So a typical day would include learning about anatomy, physiology, pathology, all the necessary information that you need to perform the job, as well as you can go to the sim center, practice simulations, screening patients.
I really enjoyed that it was a small class size so that I could get all my questions into the teachers and understand everything. I also really enjoyed the clinical part of it, so learning on the job is one of the best ways I learned.
It's very important to care for your patients and to make them feel understood, but there's also a lot of other aspects that are important for this job. It's very important to have a good grasp on technology skills, be able to work your way around a computer, a big understanding of MRI physics and how to acquire the pictures that you want, as well as good time management. Being effective and efficient in your job is also important. We have a lot of patients in a day, so it's important to get them all done and done properly. We have a lot of time in our year-long clinical experience to relish those skills and work on them further, but as long as you're motivated and interested in this program, I think you'll do just fine.